Hi, I'm John Ray with Haven Home Health and Therapy, and today we're going to talk about Medicare and patients who are 65 or older, Medicare Advantage plans, and what to do if, God forbid, they have to go to the hospital. A lot of times I'll have a caregiver or a family member call me and let me know that they have a loved one who's in the hospital. They've either had an accident, an illness, or a significant surgery, and they're not sure if they're going to be able to go home or not. So they want to know what their options are, and so that's why they call me. We talk about their payer source first, just simply because if they're just regular Medicare, they can go to almost any skilled nursing facility in the area that they want to. But if they're a Medicare Advantage plan, oftentimes there are only certain homes that are skilled nursing facilities that are in network for those Medicare Advantage plans. And so we have to kind of figure out which ones are going to be in network depending on the insurance. The next question is going to be, have they actually been admitted to the hospital or not? People oftentimes don't know that they're in the hospital for a day or two, but they may be being held under observation, which is a little bit different. In order to take advantage of Medicare when going to a skilled nursing facility and getting their stay there covered by Medicare, they have to have a 3-night qualifying stay. And most people know that part of Medicare, but a lot of them don't know if somebody's being admitted or not being admitted. And that's where the physician who's actually providing the care comes in, getting on the phone, talking with them, finding out are they going to admit them, letting them know some background of the circumstances, and if you believe that they're actually going to be needing to go to a skilled nursing facility, that's all good information for the physician to know in advance. So now, if we have somebody who's in the hospital and they have a 3-night qualifying stay, what does that entitle you to? In a skilled nursing facility, for Medicare, that qualifies you for 100 days of skilled service. Now, depending on the circumstances, if somebody goes into the nursing home and they're not progressing well with their rehab, or perhaps they've made great progress and they're ready to move on, then they don't use up all those 100 days. If for some reason they're in the nursing home, they kind of graduate, they do well, they go home, and within a 30-day window, they have to go back to a skilled nursing facility, something's happened, they can still do that, and that skilled nursing facility can pick them right back up on the skilled care. Now, the rules are a little bit different for a Medicare Advantage plan, and so it's up to the individual plan how they kind of gatekeep what services are provided. I'm mainly talking about straight Medicare, but in most situations, if something happens, once they go home within 30 days, they're going to be able to be readmitted into the skilled facility. Now, there are other options out there for different levels of care. Let's say you have somebody who doesn't want to go to a nursing home. They're in the hospital, they've had something happen, it doesn't look like going home is going to be the right choice for them. Then you can go to an assisted living facility, and they do have to have some mobility there. The level of care isn't not quite as intensive, but some of these assisted living facilities are outstanding. They have, they provide food, medication, they will help with some mobility issues. There's housekeeping and then transportation to doctor's appointments and that sort of thing. They also have what's called residential care facilities. That's where they're going to mainly do medication administration. They'll do, housekeeping. They'll make sure that they get to their doctor's appointments. In most cases, depends on where the doctor is. And in those types of facilities, it's more like they're in their own apartment than in the assisted living area. And then the last, of course, is independent living facilities. Some of the facilities they have in the area are beautiful facilities. They have areas where They can serve meals, or meals can be delivered to their room, either one. They have lots of activities. In that facility, it's more like they're staying in their own apartment again. And so there will have, some of them will have, limited housekeeping there. And then they'll, offer transportation a couple of days a week. And so a lot of activities and that sort of thing. And then a lot of these facilities also contract with home health agencies to help provide a lot of the medical care in-house, so they don't have to go out to get as many services. And so in assisted living, residential care facilities, and independent living facilities, they can utilize Medicare Part B and for their therapy services. And then and in some cases, depending on the circumstances, they can get home health services. So let me transition to home health. If they're in the hospital and it looks like they're going to be able to go home, the services that are provided under Medicare are typically a nurse is provided depending on the diagnosis and what's going on. The frequency can vary quite a bit. Therapy services are provided in the home, and then a bath aid twice a week. And then, of course, the duration of home health kind of depends on, how much help they really need for what period of time. Do they make good progress, and that sort of thing. Now, there are circumstances in which, if it were a serious illness, accident, things weren't, they were really not doing well, and they were, getting close to end of life. Hospice provides a great deal of care in the home as well. And so knowing what level of care is required sometimes can be tricky, but understanding that, number one, is the loved one been admitted to the hospital or not? And did they have the 3-night qualifying stay? Can they go to a skilled facility if needed? And then what are some of the other levels of care? So I hope this video has kind of helped clarify some things. Of course, you can always call our office if you have any further questions. I consult with families all the time to help them through this kind of stressful process sometimes. And we can do more clarification depending on a case-by-case basis. So thanks for watching.